Today in the studio, I'm with Dr. Alison Bently. Dr. Alison Bently has been seeing patients with sleep problems, both adults and children, off and on over last 30 years. She ran the first diagnostic sleep laboratory in South Africa from 1990 to 1998. After joining Wits University, she was head of the Wits Dial a Bed Sleep Laboratory in the School of Physiology for 10 years. Today, she's in the studio with us, and I'm going to ask her some questions so that she can help our viewers out there. There's a lot that we do not know in this continent. A lot. First question, let me start with two questions, Doc. What is sleep apnea? The second question, is sleep apnea a condition or a disease?
Very interesting question. So what is sleep apnea? It is literally apnea. So the pinea is breathing in Latin and the A is nothing. So it's no breathing. So it's no breathing during sleep. Now it's not no breathing as in you just don't breathe at all during sleep. What it means is that when you breathe in at night, so in some people, when you breathe in at night, because you're sucking to breathe in,
yes,
certain circumstances will result that the airway that you're trying to breathe through, so at the back of your throat here, so behind the tongue, it will close off, it'll be sucked closed. And when it's sucked closed, now you're not moving any air, and that's what an apnea is. So it means that you're not moving any air.
You are not moving any air.
It's really important to get the language right, because people tend to say that I stop breathing at night. Now that is quite sinister. You know, the idea that you would go to sleep. When we go to sleep, we just trust our body to do its thing.
Yes.
You know, it must just breathe and the heart must just carry on. So it's not that we stop breathing, but it's like having a hose pipe and switching on the tap.
Yeah.
Water is flowing and then someone stands on the end. Right, that's what an apnea is like.
When was this discovered?
So it's been described since about 1975, which sounds like a long time ago,
Yeah.
but for medicine, it's not that long. I mean, heart disease, we've been doing hearts for 300 years, like looking at hearts and vessels and things like that. So sleep has really only been going for 50 odd years, not even that. That we've been interested in sleep, that people have looked at sleep as being important for everything else, certainly for our daytime function, and certainly for other functions in the body. And it was a long time that we thought the only thing that sleep apnea did, because just to finish the story about apnea is when your throat collapses and closes off, the only thing that opens it up is when you wake up. So the number of times you wake up
So let's talk about the throat. When you say throat, you're talking about the esophagus and the pipe for breathing.
So higher than that. So the esophagus and the larynx going into the lungs kind of starts here.
Okay.
So we're talking about this area here. So it's a bit of a design fault we have. So we have an airway that goes from our nose into our lungs.
Yes.
And we have an eating tube that goes from our mouth into the stomach. Right. And if you were going to design something where breathing was so important, you'd put it in a concrete pipe. Like, you know, there'd be a pipe there, there'd be no problem. But because we need to speak and we need to take air from our breathing tube and push it out through our eating tube, we have a little piece of the tube where there's one tube for both.
Yes.
And that is also where we swallow. And so that tube is designed to close every time we swallow. We have two little valves, the soft palate and the epiglottis, and when we're going to swallow, they go like that.
Yeah.
This closes off the nose so the food doesn't go up there.
Yeah.
This closes off the lungs so the food doesn't go there.
Okay.
And then the tongue moves backwards and causes the swallowing. So we have a little system there designed to close, but should only close when you swallow, not when you breathe in. And sleep apnea happens that when you breathe in, you're sucking too hard, and so those things close off when you're asleep.
Is this condition reversible? Can you reverse it? Can it be reversed?
Well, it really speaks to like what is causing it. So if we look at what is causing it, one of the major things is age, and the fact that when we age, we kind of get wrinkles on the outside, but we get wrinkles on the inside as well. So the inside of the throat is much floppier and looser, and that we can't treat. But then there are things like if you have acid reflux, so if you have heartburn.
Acid reflux.
Yeah, so heartburn, where the acid comes up from your stomach. If it hits the back of the tongue, that gets swollen, so that can cause it. Men who put on weight, and I'm not being sexist here, but when women put on weight, it's all in the hips and the thighs. When men, it's in the throat and the chest. Okay? And so men will tell you that their collars have shrunk.
Yeah.
And we go, no, you've put on weight. Like, stop this nonsense. Because you put on weight here. So when you put on weight, the whole airway kind of goes a little bit narrower, right? Then there are things like tonsils and adenoids and deviated septums, so skew septums and blocked noses, and all of those make
Blocked noses.
Yeah, it makes it harder to breathe. Because we're supposed to breathe through our nose. I mean, the nose is the place with the hair for the big bugs and mucus and big humidification system. So that we're designed to breathe through our nose. So if we have a blocked nose, that's going to cause it. If we have at night, what often happens is the jaw, this big bone that we have here, all the muscles relax and so it moves. And if you lie on your back, then it moves backwards and then it causes the tongue to close off. So there's a whole bunch of things.
A whole bunch of things.
Yeah, that can cause this.
So what are the symptoms of this condition?
So the symptoms, and I'm just going to be,
No.
yeah, I'm going to be sexist again here because the wives are telling the husbands that they are snoring. So if you're snoring, what it means is there's a blockage somewhere, and so the air is moving fast. That soft palate at the back, that little tongue at the back, is getting caught up in this air, is vibrating. If we open our mouths a little bit, we become a very uncomfortable vuvuzela.
Oh, okay. What about young individuals?
So young,
They also
oh yeah, I mean we have children who snore. So it used to be in my age group that when you had 3 tonsillitises, the ENTs took out your tonsils and everyone had their tonsils out before the age of 8. That doesn't happen anymore. So if you have tonsils which are sitting behind the tongue or adenoids which are sitting at the top of the nose and they get large, then they can cause snoring. So we get snoring in young children right the way up to elderly people. And so it can happen in any age group. The snoring is a big thing. But there's gaps in the snoring with apnea. So the snoring, if it's just snoring that's like cutting down a forest, that's the expression we use, it's just constant and we're not too worried about that, except in children. But if it's snoring and there's snoring, so I'm going to do the snoring, so, and then there's quiet for 10 seconds maybe, and then there's, that's an apnea. Okay, it indicates that lack of noise means that it's closed off, and then that snork that you get at the end, that's a wake up. That's when the brain wakes you up to start breathing again.
Here's a question that I want to ask you, Doc. If a person stops breathing for 2 minutes, let's say 2 minutes, can they still wake up?
Yeah. We do have people who so the more severe the
5 minutes?
5 minutes.
You've got divers, people who dive underwater without...
Special people like you and I can't do that unless you can. I can't. I can't. What's interesting is that if you hold your breath, so when you're awake, so you go, hold your breath. Long before your oxygen drops, you go, I need to breathe again. Right. In sleep apnea, because you're asleep, and because that closure happens just as you breathe in, the oxygen starts to go down like this. And at some point, that's going to wake the brain up. And so the symptoms are at night, there's nighttime symptoms, but you get woken up so many times at night that when you wake up in the morning, often people who have sleep apnea sleep the whole night, they sleep 8 hours, but they wake up in the morning and they feel exhausted, like they haven't slept at all. And then they're super sleepy during the day because the brain is constantly trying to get sleep. Because during the night, the brain is having to go, should I sleep or should I breathe? Because I can't do both together. Okay. Does that make sense? And so it breathes because otherwise you're going to die. And so people wake up very tired, often with headaches, dry mouth, and then during the day they're very sleepy, falling asleep in meetings, falling asleep driving, falling asleep everywhere. So those are the main symptoms that we get.
Are you saying sleep apnea can cause headaches?
Sure can.
I have a friend of mine who says, I'm grinding my teeth, my jaws, they lock every night. Can sleep, do you think it's connected to that?
Yes, it is absolutely connected. Remember I told you about that jaw that's loose and relaxed. Yeah. So if it moves back, the brain often tries to push it forward, and by grinding the teeth, because if the teeth are connected, then the jaw doesn't move backwards. So often grinding of teeth is a symptom of sleep apnea. It is. And the dentist will give you a plate to put in for the grinding, but that doesn't stop the grinding. What it does is stop you grinding your teeth.
Okay.
You grind the plate.
Grinding.
You're still grinding, yes.
Grinding the mouth guard.
Absolutely. So grinding definitely can be stress related, so it's not always about sleep apnea, but a combination of snoring, tiredness, and grinding of teeth. You need to check that it's maybe sleep apnea.
Tiredness. There are people who are always tired during the day, but they want to sleep.
Yes.
A person who sleeps during the day, can that person experience that sleep?
Sure. You mean, does it only happen at night?
At night or during?
No, it happens whenever you sleep.
Whenever you sleep, then it happens. Yeah. Okay. How do we help this? You know, there are millions of people.
Yes.
Like myself, I did not know about this. Yeah, the millions.
So just to give you an idea of the numbers, so there was a study that did so we don't know the numbers for South Africa because we haven't done that research yet. Hopefully my new sleep clinic will. But there was a study that looked at every country in the world and looked at things like BMI, like body weight, like how obese the population is, what's the incidence of hypertension because sleep apnea causes hypertension, and looked at the modeling. So they did a modeling study and they estimated that in South Africa, moderate to severe apnea. Now, moderate apnea is when this happens 15 times per hour of sleep.
15 times an hour. Inside 1 hour, it happens 15 times. For how long?
So the whole night.
How many minutes?
So, well, it depends. So it can be 10 seconds or 20 seconds, but 15 times in that hour, you're being woken up to start breathing again.
The longest that you have discovered of time when a person is not breathing?
We've had 1.5 minutes, easily. 1.5. Remember that your brain is so short of sleep, and the only time, in severe apnea, the only time that you sleep is when you're not breathing. So you go back to sleep, you stop breathing, the brain keeps you asleep to get some sleep, and then wakes you up at the end. So the brain will always wake you up, we hope. We always wake you up. But severe apnea is 30 times per hour, and every week I'm writing reports for people who stop breathing 60 times per hour, so every minute throughout the night.
Does it affect the heart?
Of course it affects the heart, and in two ways.
Which other organs does it affect in our body?
No, I think the easier question is which organ does it not affect?
Okay,
that's the easier question.
Yes.
I don't know. I honestly don't know which organ it doesn't affect. So we know that if you have moderate to severe apnea, so what I want to get back to, the number for moderate to severe apnea in South Africa, 24% of the adult population. That's on millions of people now who have it. So which organs does it affect? The heart is the big one. Obviously, despite COVID, the heart disease is still the #1 killer in the world. So what happens, it's this combination of things. So your oxygen starts to drop and then you wake up. And with that wake up, there's this surge of adrenaline. Okay, so like, right, wake up. So what that does to the heart is the heart now has to pump harder to increase the blood pressure. So there's an increase in blood pressure, which is what causes the headaches. Increase in blood pressure, heart pumps harder, but it's got less oxygen. And so it's under strain. Does that make sense? So it's not a good combination to ask the heart to pump hard with less oxygen.
Okay.
And this is happening 60 times an hour. So it's over and over and over and over. So the heart is under strain, and that increases. So we have good evidence that sleep apnea increases hypertension, stroke, heart disease, heart failure, any heart thing, diabetes, dementia, depression, liver disease, kidney disease, everything, because it works at a very fundamental level of this destroying your sleep. And sleep is restorative, right? The whole point of sleep is that you use everything, all the body organs during the day, and at night during sleep it restores. So it gets it back to where it should be, so the next morning we start again. So if you don't do that at night, there's this slow kind of grind down of every organ function over the years because you're just not restoring. So that's it.
Yeah. Well, that's what we call product obsolescence. The gadgets, the new machines that we invent, they become obsolete. I want you to tell me, in the olden days, before the machines that we have right now, what did you use for sleep apnea?
So we had to do a tracheostomy, so the severe apneas. So if it's mild...
Trachea that you put here?
Yeah.
Okay. You drill a hole, you put you through here to the lung.
Not to the lung, just to bypass this part of the throat. So you need to bypass that, so that at night you can breathe through here instead of having to breathe through there.
Yeah, I know. When you talk about trachea, I know something like that.
Good option.
Trichostomy or something like that.
Yes, tracheostomy. It's not a good option. I mean, it's really not great. But CPAP was invented in about 1981 by a doctor in Australia whose mother died during her sleep. Big snorer. She was a big snorer, and he went on a mission to find out like what was going on. And so he invented the CPAP machine, or the concept of CPAP. Really, it was a reverse vacuum cleaner that he used that blew air in through the nose into the back of the throat. So where that area is collapsing like this, it's now held open by air, not oxygen, just air, held open, what we call a pneumatic splint, held open, and then you can breathe normally. It was a massive, massive leap forward in treating these patients.
Well, what steps can we take to combat this condition? You said it's not a disease. Is it a disease?
It's a disorder.
A disorder.
Disorder, yeah.
Not be called an illness or a disease.
Yeah, it's tricky, but we usually call it a disorder. Yeah.
Disorder. Okay.
Yeah.
So what is the difference of disorder and condition? A condition is
It could also be called a condition. These are very vague words in medicine.
So where did you study, Doc?
So I studied at Wits. I did my medical degree at Wits, and then I got into the sleep lab. The sleep lab had just been opened in physiology, and they needed a doctor, and I wanted to get out of hypertension clinic. So I said to them, if I come into the sleep lab, can I get out of hypertension clinic? And they said yes. So I went into the sleep lab. That is the only reason. It wasn't this deep desire to do sleep medicine.
Okay.
It just wasn't, because it isn't a thing. So that was 35 years ago.
35 years ago.
A long time ago.
Now, the ENT doctors, when it comes to what you're talking about, how can they contribute? Are they contributing? Are they helping?
Yes. So I mentioned there's a bunch of different reasons why this thing can happen, and the ENT is one of them.
Yeah.
But things like putting on weight. I mean, we know that men particularly put on weight as they get older. If you can not put on weight, that prevents the production. I mean, we know that weight is very closely linked to sleep apnea in men, particularly. In women, not so much. So avoid putting on weight. If you have a blockage in the nose, if you know that your tonsils and adenoids are large, for goodness sake, go and see an ENT, because they're the people who can take it out. But they will also look at your symptoms. And so we have a group of symptoms that we look at. We say, look, what is the risk of you having sleep apnea? So it's called stop bang. The S is snoring, the T is tiredness, the O is observed apneas, the P is high blood pressure. Right, that's the stop. The bang is BMI, are you overweight? Age over 50, neck circumference over 43. So you know when you buy a shirt...
Circumference of over 43.
Yeah, 43 centimeters. So when you buy a shirt, it's 44 long or that number. If it's over 43 for men, over 41 for women, tick. And then G is gender for male. You see how important it is to be male. So that's the stop bang. 8 different things. If you score 5 out of 8, 80% chance you have sleep apnea.
Okay, what is the solution of this? We have so many people out there. We are hearing this for the first time, and you have people who are suffering from this. Now, what is the remedy? What is the solution?
I think the important thing is to recognize that you might have it. From those 8 things that I've spoken about, like how many of those do you have? If you have 5, you go, there's a good chance I have it. And this may be contributing to whatever my symptoms are. If it's tiredness during the day, if it's cardiac disease or whatever it is. And then to go and see a doctor and say, I think I have sleep apnea. Does that make sense? Like don't just give him the symptoms like here's what I have. Go and say, I think I have sleep apnea, because then the doctor is targeted into that.
Yes.
Does that make sense? Like, and to look at that. They do.
I think I have sleep apnea. Yes. That's what the patient must say. They must say, I think so, that I have that. Then the doctor can focus on that.
Exactly. But if you go to the doctor, so what usually happens is you go to the doctor and you go, doctor, I'm so tired during the day. Well, you know, every medical condition causes tiredness, every single one. And that's not focused enough for the doctor. So then they might go, maybe you have anemia, maybe you have this, maybe you have that. But if you go, I think there's a problem with my sleep, my wife or my husband says that I stop breathing at night, I think I have sleep apnea. Then they go, okay, let's focus on that. Does that make sense?
What about a person who's having headaches? A person who says, I've been having headaches for over 3 years, taking tablets, drinking a lot of water. Do you think it could be sleep apnea?
So the question we need to get doctors to say is, do you snore? Like for all of these things, do you snore?
Yeah.
Because if you snore and you have headaches, well then that's a combo. That's not a good combo. And yes, you might have sleep apnea. And where the headaches come from is the brain doesn't have any pain receptors, but the blood vessels do.
Yes. You know what you say? I wish people can just send us some SMSs and say, my name is so and so, I snore at night. If you are snoring at night, please send us an SMS. The number is on the screen and we'll send it to the doctor. And if you think you have that problem of sleep apnea, please call us. The number is on the screen, and we're also putting the number of your office on the screen. So it's for the people. What you're doing here is for the people. I know you're a very busy doctor. It was so difficult for me to get you. There's so many people, but we want people to get more information. I'm from a family of people who snore a lot. I've had a lot of people in my life snoring, but I thought it was just the nose. I just thought it was the nose. So let's go to this question before we close. The question of what is the solution? Is there any machine out there or a gadget that we can use so that people should not die at night? I believe, it's a belief, I believe, I've won that a lot of people have died from this. If you cannot breathe, somebody said if you don't sleep for 13 days, not sleeping for 13 days, 1 tray, you're going to die.
It's shorter than that.
Yeah. It's shorter than that, Doc. You tell me about that.
Yeah. So it's less than that. And the thing is that what the brain does is it does take sleep. It takes like 30 seconds of sleep called microsleeps. Yeah. So, people like do the Guinness Book of Records, and they do this for like however many days. They play snooker for however many days. But even the Guinness Book of Records allows you to have 5 minutes per hour of sleep. Okay, so you collect it all up and then you can get half an hour in 6 hours of sleep. So, because we know that it's not healthy. It's not healthy to do without sleep. What happens is people don't die. So rats die, but people don't die if they don't have sleep. What happens is they fall asleep no matter what they're doing.
They fall asleep.
No matter what they're doing.
That's what they are at war.
Somebody
said he was holding a gun and he realized that he was sleeping.
It's to a point where you have to inflict pain on people to keep them awake. And it has been used as a means of torture for many, many years. Because, the thing about torture is you don't want any evidence, right? So the thing is, if you keep someone up for a couple of days, they'll sign anything. The very first case I was involved with many, many years ago, and you'll understand this, was when the police kept somebody awake for 5 days so that he would confess to being a member of the ANC. Okay. And unfortunately, they told people that they did this. And so the guy's lawyers came to me and said, you have to come to court and tell them about what happens. And the bottom line is that after 3 or 4 days of no sleep, you'll confess to anything if they promise you sleep. And once you've slept, there's no evidence. There's no evidence that you were awake.
Doc, tell us about the 4 stages of sleep.
You wanted to know about fixing sleep apnea. That's what you wanted to know.
I'll come to that one. Okay. I'll come to that one. I'll come to that one because that's the last one. Okay. That's the last portion. That's the last segment.
Okay. About deep sleep.
Deep sleep. Yeah. What is this deep sleep?
So when we fall asleep, it's not just one thing. There are different, what we call stages of sleep. So there's 4 stages of sleep. The first stage is stage 1, and I think many of your viewers will recognize it's when you're watching TV and somebody says, hey, you're snoring, and you go, no, I was awake. Okay, like that one. So it's very light sleep. We don't officially call it sleep. And then there's light sleep, which is stage 2, deep sleep, which is part of the non-REM stages of sleep, and then there's REM sleep, which is a very different type.
REM sleep?
Yes, it's rapid eye movement sleep. So people will notice it in their dogs or their cats. So they'll be lying there and the eyes flicker and they go, That's REM sleep. It's when we have all our big dreams, all our vivid dreams that we have. It's during that stage of sleep. We think that's also a stage of sleep that's very involved in memory, so that if you have your REM sleep, your memories are consolidated and put hardwired into your system. This other slow wave sleep is when we produce, as adults, when we produce all the growth hormone that we do during the day. So it's early in the night, we produce big amounts of growth hormone, and then all of that does the restorative function during the sleep. So then there's things called somatomedins and somatostatins and insulin factors and all kinds of things.
Anesthetic, what kind of sleep does it give you?
So that's more like a slow wave sleep, that's stage 3, that deep sleep. But it's not actually a sleep. It's not actually a sleep. It looks like very deep sleep, but it's not actually a sleep.
That's amazing. Because when they operate you, you can't feel it.
Well, you see, and the thing is, they couldn't do that when you're asleep, right? Because sleep is called a reversible coma, right? Anesthetic is an unreversible coma unless you reverse it. Does that make sense? So if someone started operating on you while you were asleep, you'd wake up because it's reversible, but an anesthetic isn't.
Doc, let's go to our last segment. There's a machine on the table here.
Yes.
And I believe our camera guys are going to do a close-up of this machine. This machine comes from your clinic. It comes from your office. What does this machine do?
This is a CPAP machine. So the CPAP, C-P-A-P, stands for Continuous Positive Airway Pressure. Okay, so what it does is it takes air from the room, takes it into a pump, the pump puts it under pressure, and then it blows it down this tube.
Okay.
So let me pick up the tube. I think we can see it better because it's attached to the mask, I think. So it blows it down this tube, and then this tube is attached to a mask, won't attach right now, attached to the mask, and then this is over your nose and mouth.
Over my nose and mouth?
Your nose and mouth.
Like this?
Yes.
Like this?
Yes.
Okay.
And so what
is coming out here?
So just air is coming out here, and air is being pushed into your nose and mouth, into the back of this area that's collapsing and holding it open.
Is that air oxygen?
No, it's just room air. It's just room air. Just room air.
Okay.
Because the thing about it is you can, if you can get the air through that tube, your lungs will manage the oxygen. I mean, it doesn't need extra oxygen. Most people don't need extra oxygen.
Dr. Bently, what's the difference of this machine and the machines that we used to buy during COVID-19 that we used to put here for oxygen and things?
Yeah. So those are oxygen concentrators. So what they do is they take, so the oxygen in the air is about 21%.
Yeah.
So they would take that air and concentrate the oxygen so that what came out was stronger than 21%. 30%, 40%. Okay, so that you're getting more oxygen in, because with COVID, what COVID did was affect the lungs. So you couldn't get the oxygen into the blood. Right. The only thing stopping your oxygen getting into your blood is the fact that the pipe's closing. So if we keep the pipe open with the pressure, just the normal pressure with normal air, if we keep the pipe open, then the oxygen can do it.
Can this machine keep the pipe open?
Yeah. That's what it does.
It keeps the pipe open?
Yeah.
For how long?
Just up here, for the whole night.
For the whole night?
For the whole night, yes. So
and then you breathe properly?
And you breathe normally, and if you breathe normally, you sleep normally.
And you'll snore?
No, you shouldn't snore.
You shouldn't snore?
Shouldn't snore either, no. So it
because
should manage the snoring.
Open, then there's no snoring.
Yep.
It's for the first time for me to hear about this machine. And you have these machines?
So I don't. So, but there are companies that sell those machines. Yeah, okay. I'm not allowed to sell machines. Doctors aren't allowed to do that.
I know.
So I do the diagnosis, and I do the.
Yeah, because there's a company that has borrowed me this machine. Yes. There's a company that has borrowed me this machine, and they showed me that you can set it up to be higher, and it can control itself.
Yes. So this is an auto machine. So there are two types of machines. There's an auto machine, which is this one. And in the machine, there's a sensor that picks up vibration. And so if there's vibration in the pipe, it goes, you're snoring, right? There's noise. And so it pushes the pressure up, and then it continues to push the pressure up until snoring goes away, and then it starts coming down again. So it modulates and changes the pressure over the night. The cheaper machine is the fixed pressure. So we use this machine to kind of go, how much pressure do you need? Like, how much do you need? Because it varies between 4 and 20. So how much pressure do you need? And then once we know how much pressure you need, then you can get a fixed pressure. And the fixed pressure is set at, let's say, 10, because we find that out from this machine. And then that machine pushes the pressure up to 10 and then just keeps it at 10 like that for the night. And then you just sleep.
Doc, there are people out there who are suffering from headaches for years. If they can have this machine and stop taking tablets. I don't know whether I'm using an archaic question or what, but I'm just saying this hypothetically. I just want to hear from you. There are people who are taking a lot of painkillers, and they end up having a problem of kidneys, and they're not drinking a lot of water. The question is, if they can stop taking tablets and go to the company that sells this machine and have this machine at night, wear it at night, can it help the headache?
So it can, because when you wake up after every apnea, that increase in blood pressure shoots up. That's what it's hurting in the morning. It hurts the vessels, the blood vessels, to have that push all through the night. And you can get headaches. So is sleep apnea the only cause of headaches? No, it isn't. There's no question. So what we always advise is that you do look at those 8 things. So yes, you have headaches, but do you have those 8 things as well? Snoring, tiredness, blood pressure. Do you have all of those as well? Because if you have those as well, then certainly you should investigate whether you have sleep apnea.
Okay.
So then we would always do a study to go, do you have apnea?
Okay.
Like, do
so
you have
if they
one?
have the 5 things,
Yeah.
and now they take this machine and they wear the machine during the night. During the day, are they going to have headaches?
No, it don't know. So we're never quite sure whether the headaches are being caused by sleep apnea. So that's why we say try the machine. So we always use 3 days or 4 days, try the machine, see if it resolves the sleep apnea, see if you wake up with a headache. Often people with sleep apnea wake up with a headache and then they just have a headache for the rest of the day. So we'd always go get the diagnosis right, because if you don't have sleep apnea, then this is not going to solve it.
Doc, technology changes every day. From the knowledge that you have in the future, let's time travel and go maybe to 2060, 2040. Do you see new machines that are advanced to help people who are experiencing sleep apnea?
I don't know. There are some other technologies and some other kind of treatments in the pipeline. So, for example, there's some medications that can help sleep apnea because they increase the muscle tone. So they improve the muscle tone in the throat. So there are some medications that are coming through. There's nothing really in the CPAP line that's looking to be any different. I mean, this is just where it is. Lots of people don't like CPAP. So we do need to find other options for treatment. There are some surgeries that can help with sleep apnea.
Or surgery?
Yeah, but all of those have to be investigated properly, and what's important with surgery is we need to know that we're doing surgery on the right people. So, if you just do surgery on everybody, then it's not going to work. Like, there are lots of people it's not going to work. It will work in some people. And so part of the problem with all treatments for medicine is who are the people that are most going to benefit from this particular treatment? So there are treatments. There's some things like Fitbits. So if you have a Fitbit, the top end Fitbits now monitor oxygen at night and now monitor your pulse rate.
Fitbit?
Yeah. Okay. So they will give you.
Who feeds?
No, people who have these watches things, the wearables, what we call the wearables.
Okay.
It monitors the oxygen in your blood, and so it can tell you if your oxygen is very variable at night. So if you find that, for example, when you look at your Fitbit data, and you go, the oxygen is all over the place, you must go, maybe I have sleep apnea.
Yes.
That's an indication that you might have sleep apnea. So I think those are going to become more important as we go along. They're getting better and better and better. But we need, always in medicine, we always kind of go, let's get the diagnosis right, let's diagnose it, and then we have treatment options after that.
Doc, that's your camera right there, that one there. What is your message and what is your advice to a person who says the 5 things that you have mentioned, I am experiencing them? And what is your message to those people?
So I think it's really important to take your sleep seriously. I mean, sleep is for restoration of the body. If you don't sleep, whether for whatever reason, over a long period of time, your body is going to take a hit. And if you're snoring particularly, if somebody has ever said that you stop breathing at night, please go and tell a doctor that, because you may have sleep apnea and it may revolutionize your daytime function. I mean, you might be much, much better during the day, more productive, not so sleepy, and prevent long-term complications, those long-term disorders that we don't want to get, heart disease, diabetes, dementia, all of that.
Dr. Alison Bently, thank you so much for coming to our studio, and it's for the first time, I must say this, it's for the first time in the studio to interview someone who has this kind of knowledge, and this knowledge that you have, the knowledge that you have is very imperative and important to our people and even to the continent, the world. And I know that there are other doctors out there, maybe in America, in China, who are doing the same thing, but this country is blessed to have a specialist who is in this field. And as a theologian, I must say, may the Lord bless you and keep you in His grace and prolong the days of your life and propel you to heights of power, to heights of victory and phenomenal accomplishment.
Please introduce yourself to us.
Okay, so my name is Wela Kulwa.
Okay, I'm Young Boy Vic, as I'm widely known as Young Boy Vic, or Geno.
My name is Njabulu.
My name is Unati and I do websites for people.
Albert.
Hi, my name is Pitlalo Sejwan.
Hello guys, my name is Kyabetwe. In the streets they call me Genie.
Do you snore when you sleep, or know of anyone who does?
No, I do not know anyone. No, I do not snore, but I do know somebody that snores, or people that snore actually.
No, I don't know anybody. Oh wait, no. No, I don't snore, but I know someone. I know my dad snores, but yeah.
Yeah, I used to snore. Right now I don't snore. Yeah, I don't know what happened, but I don't snore. But I know people who snore.
Nah, I don't.
No, I don't.
Nah. I don't know, but people have told me that I snore actually, yeah.
What do you think causes snoring?
I am not too sure what causes snoring. I think maybe it's just inherent within people, but I'm not too sure what the cause is.
Sinuses? I think it's sinuses. I think you have sinuses. I'm not sure.
Yeah, that one I also don't know. Maybe I would like a lot of snot or something.
Flu or nama sinus?
I like to think it's because of the airway, so the way I position myself while I sleep. Yeah, I think it's because of that. Certain positions when you sleep cause you to snore because you're blocking the airway, so air has to escape one way or another. So, it causes, yeah.
Have you heard of sleep apnea?
Yes, I have.
And what have you heard about it?
So basically, sleep apnea is the brief interruptions of breathing during your sleep.
I think it's lungs, something to do with lungs, because it's like heavy breathing or something towards those lines, yeah.
For any peoples, for another peoples, sometimes peoples, even like today, Monday, this Monday, people starting to waking. You see, sometimes you are starting morning, finishing evening. You see, sometimes you come back home, you are relaxed. You gonna take time to sleeping. Sometimes you take tired too much because you are waking too much. See, then sometimes support to make a program for time to balance time for.
No, I think that's the cause of snoring. I think.
Sleep apnea. What is it? What it is? When you can't sleep, you find it very difficult to fall asleep. That's what I think it is.
Never heard of it before.
Same.
I have an idea of it because I've heard it from a comedian. So he was talking about him having sleep apnea. So yeah, it's somewhere along the lines of heavy breathing or something, a blockage through your lungs or something along those lines.
I think I have that a bit, maybe. I might have, because I wake up really tired. I have to cough a lot when I wake up, so I think maybe something is blocking my airway.
If I may ask, where did you acquire this knowledge?
I'm someone that likes to study things, so YouTube, Google, medical conditions and things like that, so I'm really deep into research.